Well, hello there, everyone, and welcome to another episode of Wombs with a View Maternal Musings with Jennie and Sylvia. I am Sylvia,
I'm Jennie.
and we actually have another Jennie on with us today. We have a special guest, Jennie Anstey, one of Montreal's highly regarded osteopaths, who's going to be talking to us today about all the different ways that you and your family can benefit from osteopathy. Did I say that right?
You said it perfectly.
Is it
Sylvia and I always
osteopathy,
osteopathy.
osteopathy?
Osteopathy, I would say. Sylvia and I always have
Osteopathy.
these debates of, perineum. How do you say perineum?
I say perineum.
I say perineum.
Perennium. I hear you both.
Mine's not mine anyway. Osteopathy. Osteopathy.
Osteopathy. Well, I'll say it the way you do. Well, welcome, Jennie. We're really excited to chat with you today about all the ways families can benefit. And Jennie B and I were saying that we've only each seen an osteopath once, and I saw you a few years ago. And Jennie, did you see Jennie?
I didn't see Jennie for that, but Jennie and I did a workshop together a couple of years ago where I was teaching yoga, like a restorative kind of yin class, and Jennie was going around and doing some magic movements on everybody, and that was really, really cool. But yes, I only saw an osteopath once, even though, it's kind of like the pelvic floor physio, which I've never seen one. But as doulas, I'm always referring to the pelvic floor physio, and I'm always referring to the osteopath, because I know anecdotally and enough research, I know how magical and how almost crucial these two things are. But I went to see an osteo after a car accident, and it was a really cool experience. I was like, because I'm more of a massage girl. Like if somebody's going to touch me, I'm going to go, with that oil massage we were talking about, Jennie. Like I want, But I went with Xavier Terrien, and it was like he did this thing on my head, and I was like, hi. It was like, who needs drugs when you have whatever he did on my head? Anyway, it was a good juju, I call it. It's good. The good juju.
The good juju.
Yeah.
Nice
work. Yeah.
So Jennie, tell us a little bit about yourself.
Well, I'm really, I really love what I do. I feel really, really blessed to be able to work in an area that I came through in a roundabout way. Essentially, I came to university and I did my undergrad in physiology at McGill. I really wanted to be a physiotherapist, actually. But, fate has it that I kept applying and never got in and ended up graduating and throwing out every textbook I ever had, and went to train as a pastry chef, actually.
Oh, very different.
Yeah, that's my funny story. But what ended up happening with that was a theme around really being drawn to working with my hands, really. And I really, was working, as I did a lot of research, and I worked at an amazing job at the MRI department at the neurological hospital after McGill. And I think that's sort of like cerebral research. It's great. We need that, I guess. And there's some people might be well designed for that, but I needed to interact with people. So anyway, I did pastry. I came back and I was teaching Pilates at that time. At the same time, I had those two. And, over the years, I had clients who, I'd refer them to their osteo, their chiropractor, their different professionals. And I would call them and say, hey, I've got your client. I'm training them. Like, how can I help your work? And not really getting the time of day. Like, oh, you're just the trainer. Like, and so over time, I'm like, you know what? I'm gonna brush back up on my anatomy and kind of like get my foot in the door in another place. And I stumbled into the first year of an osteo program. I was just going to do the first year, and I got hooked.
Nice.
So I ended up staying.
What a great story. What a great story.
Yeah, it's a long program. It's like six years. It took us almost 7 years by the time we finished all of the things to finish. There's some most of them are part-time, where you're really taking seminars, practicing, you can really integrate the information. Yeah, but that's my story. And those same textbooks I threw out, I actually rebought them. And that's really out. And I was like, well.
When you say, Jennie, that you got hooked, like we were talking a little bit, and I said a moment ago that to me osteo is magic, and like it's not as much as an obvious thing when you're watching it done as physiotherapy or as yoga or as Pilates, or like it's like, is it Reiki? Like what magic? Can you demystify osteo for there are people watching who have not who don't have experience with this. So what is osteopathy?
Yes, it does encompass a broad spectrum of many different, I'll say, tools in the toolbox that we are trained to work with. But the basis really of osteopathy is something called the primary respiration. And so basically this is an expression of cellular respiration. So all of the processes that we would have in a cell, where a cell has a certain metabolism, and it's getting rid of its metabolic product and so it's breathing, it's getting rid of waste or getting rid of waste and bringing in nutrients from the cell. So there's an information on a cellular level that interacts with the extracellular fluid in the body. And that does create a whole body mechanism of breathing. So sort of an expansion and a contraction phase in the tissues. And that breathing is very, very specific for the bone structure. So it's not just sort of, it's a water dynamic, but it's also, there's a biomechanical component such that in a way, all the paired bones will have an expression of an external rotation and an internal rotation at a very specific biorhythm, which is around 6 to 12 cycles a minute. So that's a little bit slower than our thoracic respiration, our lung breathing. And so the body basically is and then from that stage, we can go into, it's like putting your car, in like third gear, and then you can sort of downshift and you can come into even slower biorhythms, and then even slower biorhythms. So as we are working with the body, we're observing these rhythms that are inherent in the body, but also reflective of greater rhythms in nature. And so I have to say that the only reason I think I can do this work, coming from the background that I came from, which was personal training, teaching people that, like, here, if you want to get better, sometimes you got to work. You can't just like be magically healed. You got to like do some work, like stretch your muscles, do a little workout, like do all the things. But I mean, I was really, I couldn't just lie there like dead meat and have someone like not listen deeply to what my real need was in my body and follow that. So when I discovered osteopathy, I realized like, oh, they're listening to me, and it's like my higher self is taking over. That's what I kind of say, but it's not just me. It's something greater than myself and the client. It's actually the same forces that are moving the water in the ocean, in all water on the planet. It's managed by these rhythms, which are much greater than our little me, our own will, And so it's basically, the work is really an act of surrendering our body to those greater rhythms, which really animate us, which work within us. And it's my job to kind of, I'll tell you what I tell my clients, and it's like, you have to just lie down. When you feel my hands move, you can know that I'm not moving you, but I'm hopping on your train, and together we're going for a ride, and we're seeing how the body moves. And if I'm on someone's sacrum, and suddenly I can feel like, oh, it's tilting to the left, oh, and coming back. Oh, so you can start to see these rotations, and we can have some really specific diagnosis. And as we're looking in the spine and double checking how all the vertebrae are stacked, we can sort of see, oh, look, L3, or maybe the higher vertebrae up is in left rotation, and you can feel it through this accompanying of these cellular biomechanical movements in the body. And it's also my job, and this is so small because those movements are overlaying, they're going on 24/7. They're going on when you're sleeping, they're going on right now when we're sitting here, they're going on even if you're running and moving around and doing things. There's still that orchestra, that rhythm. So the body is a whole, all kinds of biorhythms. And we're listening to a particular frequency, a particular rhythm, that's really managing our whole posture, bone structure, and metabolic process in every organ too.
I think I could sit here and listen to you all day, Jenny.
Right?
Taking my breath
And
and
it's
trying
the
to
client.
imagine this. The question I had that came up though when I was listening was, I would never say to myself, I think my breathing and my rhythms are off. I must see an osteopath, right? I mean, when do people, like, when do they come and see you? I know when I go to the chiro, it's because my back might be just feel like it needs to be moved, or something skeletal. When do people come? Like, they don't talk about the breathing and the rhythms.
For sure. Yeah. We have the foot in the door is always, physical discomfort or pain.
Mhm.
And
Right.
that's the great wisdom of pain. It's so beautiful. It can really,
Mhm.
I hate that. I don't like when people are, "Mm,"
It's a
but
message.
pain is, and those discomforts are really powerful places for people to say, the body's saying, hey, something's not right here. Hey, tune in. Hey, right here. We have, and they're doorways inside. And, yeah, there are doorways within, and that's so people can, have a twisted back, or I mean, from carpal tunnel, like long-term postural things that they may be dealing with, or suddenly they're doing a funny movement, they're putting the seatbelt on and they twist their back, and then they end up,
Mm.
you have many options. You can go to massage therapist, chiropractor, physio, osteo, and I don't even care who it is, really. Just someone that is able to evaluate and double check the alignment and assist your own body's wisdom to find, oh yeah, I'm gonna, and sometimes when we're in a squeeze and people are coming like bent over in pain, this is it's like a detox. It's like when you take a dish rag and you're squeezing out all the old waters. And this is a powerful place for someone to be in. They're really choosing to maybe work through an old pattern that's no longer serving, and looking to fully go into the movement. And sometimes you have to be a cheerleader for them, because when they're on my table and they feel like, ooh, here we go into the contraction, and they don't go in all the way, I'll say, and oh no, it's there, it's painful,
They're
I'm not
not
going to do it.
ready,
And I remember that from birth,
right?
giving birth,
Mhm.
the midwives would tell to me, oh, and I'd be like going up,
Let it go,
or
let it go, let it go.
yeah. And then they were like, no, just let it. I'm like, okay, I gotta let the I have to give over to that movement. So this is part of the coaching with my
Mm.
hands that we end up doing also, is assisting
Yeah.
people to go in all the way, to allow those cells, to allow the body to fully go into what it's needing to do. There's always a wisdom in behind when someone twists their back.
Mm.
It's because perhaps it's not just the spine. It could be that maybe, the liver is needing to turn. There's something in the lung that might need to rotate all the way. And we need to go all the way into that before we can kind of like trampoline back out into a neutral, comfortable position. So,
Yeah,
um,
I use that analogy too in birth, Jenny, about, listening to your body, like the pain, positive pain, it's telling you which positions to get into, which position your baby needs you, or which position your pelvis needs to, perhaps it's not just lying there, right? We need to be mobile and moving and listen to the body. But I don't think we live in a society where it's go, 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 go. And there's always music and always telephones and TVs and the noise, noise, noise. And we don't take that time. So I'm happy that by the time we do address our pains, we're at that point where we're welcoming change and we're welcoming healing on various levels.
yeah, exactly. And sometimes even when people are coming, and I might even be evaluating them seated up for example, sitting up, for example, they might go into a position, and then they're feeling their body, and all of a sudden, ooh, they start rotating, they go, as opposed to me just seeing that they're rotated and then, oh, let's fix you.
Mm.
No, sometimes they need to go and experience, and so it's accompanying them fully into where they want to go, allowing them to go all the way to the end of that barrier, wherever that is, for the tissues or for the bone structure or for the organ. And then naturally we will always hit a wall. We'll always hit our turning point, just like with the breath. We're going to hit that maximum movement, and then there will be a descent. And that's also so reassuring when someone is really in a pain or a very acute phase of something. It's squeezing, it's painful, but at some point, there will be an expansion that will release. And so it's just allowing that cyclical cellular tissue breathing to be reestablished.
Is there anything you can't help with? Like, again, when we're referring people, like, oh, go see an osteo, like
sciatica,
just like
yeah.
throw people at you guys, but like, you're talking about the movement of bones, but you're also talking about organs. Like, I have a student, for example, just who has a very sore arm. It's repetitive strain and it's very inflamed. And so as we were talking before we started the show, that's like, okay, well, I'm going to go to the doctor and get an x-ray. Okay, well, then you're going to get anti-inflammatories. Like, this is, is there any, like, with that kind of thing where I can't see what's going on as a yoga teacher. I have my theories and I understand her limitations of movement and what she can do without hurting herself. But like, is there anything you can't help with? Like, is there anything that's out of that scope in terms of inflammation or the internal?
Yeah, sometimes there's tears. Sometimes also, and evaluating, for example, a great example is ACL tears in the knee, for example, different ligament damage that's happened. Certain mobilizations, obviously, in those cases, you would not be doing, and there are specific tests that can be used in medicine and physiotherapy, and some of the ones that we're also trained to evaluate before mobilizing. Another really important one is, for example, the vertebral artery in the neck. There's specific ways that we need to test for listening that artery is already preserved, because you certainly would not want to create any rotation, side bending on any calcification around an artery. There can be things that are that would really need to be avoided. Obviously, some cases of treating cancer, there are some things that we don't treat. And there's many times where someone might come. It's our jobs. Sometimes in the evaluation, that's happened to me several times, where someone has come and I have to say, unfortunately, I'm not able to treat you at this time until we have more information. If I'm taking their case and I'm realizing that there's other factors that need to be tested, they may need a blood test or basically a more detailed scan, that then we could rule out, kind of create some more exclusionary diagnosis before coming to an osteopath. That is also part of our job. And it's also part of my job to be working with someone and, be palpating along some of the organ systems. And if you're really finding a lot of big lymphatic nodes, for example, I'm the first one I will refer, like, you need to have this double checked, like now. And so if you hear me say that, if clients know me enough that I really, if I open my eyes like this and I say, I need you to double check this, or I need to go to the doctor, they go. Because we can do a lot. And there's also some cases where we're working and I've had people with really big lymphatic nodes and I say, okay, in parallel, we need to have that followed medically with your doctor. And at the same time, we are going to dig in and start to clear a lot of this work manually with your diet. Some of the, I know another example is, working with some of the Palma Christi oil and all the castor oil packs. It's another, anyway, there's a lot of other things that is not necessarily obvious, things that I could suggest they look at. Even nutritional counseling is not something that is part of our particular training. If I'm sharing that information, I might just have to say there may be elements. If I'm working by the book underneath our umbrella of osteopathy, it's really, you may need to double check a little bit more on the nutritional basis. And they might brainstorm themselves. Usually people also know, like, oh yeah, this is out of balance. And if you ask people, what area of your life do you feel that, could use improvement? They know. Deep inside themselves, a lot of people know which.
Yeah, I know where my pains are. Yeah.
And they know what habits that they could be ready to shift. And there's sometimes that you're just not ready to shift them, and that's okay too. But it does help to have someone look you in the eye and say, what do you know you need to change?
Yeah. Let's talk about pregnancy and
Yeah.
postpartum. So I have two things right away that I'm thinking of, which would be sciatica. I mean, a lot of women have sciatica, lower back issues, actually more than two, carpal tunnel after birth in the, I had it in both wrists just by holding baby all the time.
Yeah.
Reflux in pregnancy as well. Are those types of things? Are all of these things people can come and see you for?
Yes, exactly. There's a lot of women that I follow throughout their pregnancy, and there's many things that we're evaluating. In terms of posture, it's a very interesting time during birth because, you know, the position of the baby is the most important. So what it is when we're evaluating, it's not a time where I'm like double checking someone standing. I want to make sure, for example, the sacroiliac joint, that articulation between the triangular bone, between the glutes, the buttocks, and the two iliac bones that are sort of the chalice, I call it, of the body, holding baby in and allowing all of that nice movement. Again, we can feel, we're listening for that the iliac bones are doing their natural in-flare and out-flare movements, and then there's the underlying movement. They're not going to be doing, it's not until really they're in labor, they're going to do a full biomechanical movement, but we can already be listening and hearing and feeling the femur, the ilium, and the position of the pubic symphysis as well, and the alignment of the lumbar spine, that things are mobile enough so that if the baby should need to shift too, because sometimes they could be transverse, and then they're a little bit inclined, then they may be head down, head up, wherever that the baby needs to go, where the placenta is placed. There's so many factors, and it's like the woman has to be kind of a vessel for the needs of the baby. So I always tell women, don't worry if you feel a little cockeyed. Our job here is to allow you to feel that you have the adaptability to be able to manage well without pain, the baby's needs and her needs as well. But it's certainly not a time where you need to be textbook straight posture, that's for sure. And that's really reassuring for many women, because they feel like, oh, I feel like I'm over here. And then it's like, okay, but can we move over? Yes, I can, but I prefer this stance. And sometimes there's ways that when they're testing and I say, hey, look, but your body can do this. It's just that you may not be in that position so long. And then they feel reassured. Oh, I can do it, but I'm in this posture because maybe that's the best for baby now. Maybe next week it's going to be different, next month. So as we're following the mother, making sure that just all of the joints and bone structure are available, it's amazing. And many women feel, oh, Jennie, yeah, I know where I'm at. I know what I'm capable of and what my body can do, so that when they're heading into birth, we know that they're not going to end up with big surprises like that something was really stuck. And I'm very evaluating a lot of things also at the very end of a pregnancy, after 37, 38 weeks, that I may not do earlier, different things that we would do or not do depending on the stage of pregnancy. And I personally do not treat a lot of women in the first trimester unless they've already been a client of mine or I've already worked with them in the past. I like to let that first trimester really settle in, and it's not a worry, but I feel that there's it's a time of resting and integration and not making a revolution in the body at that time.
So nice. I did not go and see an osteopath when I was pregnant. Any of the 3 times. What about after birth? Let's jump into like newborn care. We have like babies are crying or they're having issues breastfeeding. How do you, I mean, I've sent clients to an osteopath for breastfeeding issues and they've come out of there and babies much, I don't know, is there something in the neck of the baby? Talk to us about that a little bit.
Yeah. Well, mom and baby are still, they're still together. They're still a unit, kind of like 9 months in, 9 months out. Also, there's this process where I usually treat newborns and the mother at the same time. So usually both will receive care in a postpartum session. There's many issues that could arise for the mother and or the baby, but Generally for the moms, we're double checking sort of the height of the uterus, again, the mobility of the ileum, and double checking how everything is sort of reorganizing in the abdominal wall. If they've had a C-section, we usually would wait till at least 8 weeks afterwards, 6 to 8 weeks afterwards. But then at that point, we can really be working. I can do, if it's in maybe the first 4 weeks, I can do very gentle work along the four layers of the abdominal wall, just to make sure that there's a good integration of movement and mobility in the connective tissue. But come 6 to 8 weeks, we can work a little bit more, for example, on the scar tissue, just to really make sure that the movement all the way down the linea alba is connected again. The infants, we double check many things. We are double checking the movement of the femur, that they have this full external rotation in both legs. We're double checking actually all of the bony structure of the feet, knees, ankles. We're double checking. For many kids, better to talk about examples, because this is usually what people like to hear. For example, I have a lot of babies coming. Sometimes they come after they've had, for example, tongue tie, anterior or posterior tongue tie, and or they're coming just before. They're saying, I think I may have to have
like before surgery, you're saying, before getting it clipped.
And I said, okay, yes, but sometimes that the baby can't extend their tongue out, but it may not just be the frenulum. It may be like that there's something either in the diaphragm that is stuck. So if you can imagine, this is one tube all the way down through here, through the whole digestive system to the anus. It's one, embryologically, it's one tube. So we need to check. That's why even evaluating the pelvis is important in those cases, but notably the thoracic diaphragm and any usually torque. I've had so many infants with tongue tie where they've had either like a shoulder dystocia that has gone undiagnosed, and or just a restriction on the movement, because really it depends on, it's particularly for posterior placed infants as well, when they have to do this a lot more rotation in the pelvis. This means that there is a phase 2 where the clavicle and the thorax have really had to turn a lot. So the clavicles and the upper thoracic area are very, very important. For the use of the tongue. And we're double checking the hyoid, the cricoid cartilage, the thyroid cartilage, and then the integrity of the clavicle. This is really, really important for many infants. For the full use then of the jaw, we're also evaluating if there's any micro deductions in the mandible and how all the mandible works. I'm also double checking for many infants the palate. There's the 4 bones in the palate, the 2 maxillary bones, and then the 2 palatine bones behind. And the palate is very interesting. When the facial structure, I have my finger here, when it opens, when it expands, it actually flattens. So the palate will flatten out on an expanded cellular expansion, and on an exhale, it'll come like into a Gothic palate. So you can have a really narrow palate, and this is one of the areas that we're also evaluating for the cranial shape too, because there's the kind of like, I'll give you the general view would be kind of like the Ernie and Bert heads, like Ernie was very wide, so you'll see those infants very flat head in the back, but very wide transverse diameter side to side. They will have also a very flat palate, a very expanded side to side. But some of the infants who are presenting with, sometimes you'll see it on their hairline. They have little mohawks, and they're really a pointy skull, and or they're narrow. They have a long head, front back. And if you put your finger and you can see that they have a narrow palate from the occipital sphenoid movement. And it's actually through this area that we would be working with them to create the flexion of the sphenoid, the diving forward of this intercranial vertebrae.
Oh my gosh, Jennie.
But
Wow,
we
this is
work,
like so amazing.
but that you have to catch it early. And again, this is
Yeah.
really, really important for kids because
Mm,
it's later that they have orthodontic issues,
issues.
and that can
Yeah.
be really worked with so effectively
Mm,
in those first,
in
you
those
know, you
months.
have a little bit of time, but mm, you
So
have a little
Jen,
bit of time to 8 till 18 months. It's
Mhm.
everything is fixed more or less for some of the major dental arches and whatnot. So all of those little things for assisting.
those little things, my God, this is such a huge topic for us as doulas, and I, you know, guys know I work as a postpartum doula, and I also have this kind of my own story of having tongue tie and lip tie. You know, these are veneers because when I
Oh,
don't have my fake teeth, I have a big space. I have lip tie and I have tongue tie, and I always have, and I was bottle fed, so we never picked up on the issue. And I
yeah.
have two kids who are also lip and tongue tie. Anyway, for a lot of reasons, this subject is like super interesting to me. I do, however, tend to send people first if I, you know, and I can't obviously diagnose a tongue tie, and half the time, you know, doctors and nurses don't, you know, have anyway. But my initial reaction is, okay, go see an IBCLC as like a first line person, which probably is still a good idea. But from what you're saying now, you know, and a lot of the, you know, a lot of the IBCLCs, which International Board Certified Lactation Consultants, will then say, okay, also go get body work done. So this combination you're talking about. But in hearing you explain all of this, I'm wondering if an osteo who, and I think all osteos, because of the amount of training, know what they're doing, but I think some, you know, are used to babies more than others. I'm just wondering if the osteo could be a good first move. Do you understand what I'm not saying like, oh,
I do.
See you first. Yeah.
Yeah, and I think I don't know so much about the lactation consultant and what their training is for evaluating some of the movement, although I know it's so needed just for the support and watching. Also, it's one thing I don't do so much, although that said, I do treat many infants while the mom is breastfeeding. You know, sometimes they're coming and they're literally breastfeeding, because when you're sucking, that sucking mechanism, I can feel what's happening at the C0, the occiput, and the junction of the back of the skull and the first vertebrae really well when they're sucking, when they're breastfeeding. Well, we're definitely part of that team.
Part of the team. That's right. That's right. Well, it's just good to know that there are options, right?
Yes, and
Um,
it's interesting for families. What I really wanted to say was, I just, every time a parent brings me their newborn, or any of child really, or anyone, it doesn't really matter the age, but especially the newborns, it's honestly a big honor. And the only way that I can do this work is when I can explain to the parents, and often they've already come themselves before, or sometimes they know me, but if they don't, to explain that it's not what I'm doing to the child. You know, I have some grandparents coming in with the mom, you know, to
they're
hold the
worried.
baby while the mom is being treated on the table. So sometimes I have like the 3 generations
Mm,
there in the room, but they're always like, what are you going to do to the baby? And, you know, like manipulate the baby. And I'm like, oh, it's not about that. The baby is the boss. The baby is the boss. They are going to show us exactly what they need. And
mm,
like when I say that, I'm like, what does she mean? But I'm telling you, if I hold the stick, that baby is going to go into a banana, going to turn, going to do. It's like a modern dance show sometimes. And
wow.
they, from 2 weeks old, they
mhm,
can get what they need with a
mm,
good fulcrum, and which is part of the work that we would do to allow their system to unwind. You know, because they're all
mm,
curled up in there, and even one of my teachers, he came for some of the anatomy discussion, but he was saying, and he's a pediatrician. He didn't actually know a lot about osteopathy at all, even though he was teaching us for 2 days. And he said, "Oh no, I just get those newborns on the table and get them all up, and I can kind of feel where they were in the womb in those last weeks." You know, and I
yeah.
thought, wow, this is like a regular doctor really allowing the babies to kind of re-experience that tight binding position that they were in, and allow them yet again to unfold. And so we do that. We go back, we unfold. It takes time
It's
to
super
unfold
interesting.
into the world.
I had one client, and when you don't know what to expect, I think that she didn't know what to expect, and she came back and said that was just horrible. She just put her hands on my baby, and it's not you. She put her hands on my baby and did nothing. There was nothing.
Yes.
And then I'm still having the issues, and I'm like, okay, well, the expectations of the crick and the crack and the moving and they expect lots of and with just so you know, yeah, there's not much of that going on. I love the way that you talk about that. Before we end, I would like to, one way that you differentiate yourself from, I think, a lot of other people in your field is the work you do with water. And
in the water.
In the water, the word rebirth comes to me. I'm just going to let you explain what that is, but I believe that is one of your big the ways that you work is getting people in the water. And how does that work? What does that do? I know we could do another show just on that. We could just do a show on that, but I think it's just fascinating. So before we head out, I just wanted to let people know that this exists.
Yeah, for sure. No, it's again, the basis of all human movement and how we're formed is in the womb. It's in the amniotic fluid. And that fluid, the remnant of that fluid is the cerebrospinal fluid that is pumping up and down throughout the spine, irrigating the brain, the whole nervous system. And so, and this is good for us moms to know that, your little one is going to have, your little one who's an adult even is going to go away from home and still have the seed of that amniotic fluid within them for their whole life. Keep reproducing it, cleaning it and making more. But in the water, yes, the body is free of the table. When I have somebody on the table, you can't see if they're tilting to one side. So when we work with flotations on the head, on the feet, or on the legs. And even just the beginning of a session, or you watch someone floating and you see, all of a sudden you can see exactly where the density is, where the area that may not be fully expanding and contracting, just by watching someone sort of self-equilibrate. But there's a lot of movement that we can do that's not possible on the table. It is not my practice to work much with infants in the water, although I have done sessions in the water where it's been extremely challenging, and in some birth trauma that I couldn't allow, the baby couldn't relax, and I brought them in the water, and it's like a miracle. Anyway, but for adults, it's very powerful work, and sometimes part of the work is also a deep journey within your own mind, within your own memory, and by being in the water, you're really tuning out even more easily the outside world. The ears are submerged, you're closing your eyes, and you're really in a different environment where it is much easier for many, many people to access deep, ancient memories of certain traumatic events and things in their life. And why that is, I'm still exploring. But there is a magic in that is really beautiful. It would be my joy to have at least once in someone's life that return to the water for. But we can all experience that in our quiet moments in the bath, just letting ourselves release. And I do explain to many parents the benefit of being in with your baby in the bath, and some of the just a very basic movements that they could do to help their baby while present with them when they get down together in the bath. Yeah, and I can link for your clients after if you'd like. There's another osteo in the Eastern Townships who has put together a YouTube video explaining that for young parents with a newborn, and I would love to share that video with you.
Please put it in the comments afterwards.
Yeah.
Jennie, it's so amazing. I feel I could just sit in here and chat with you and ask you questions.
I feel like coming for a treatment.
I want to go in the water. And Jennie, didn't you have a workshop down south at one point where everyone went down south and had trained, like I don't know, experiences. That's Jennie B. I think that's what we need to do, huh?
Go down south with Jennie A.
Yeah. Oh,
Well,
it'd be my joy to organize
you.
another one of those again. And but in the meantime, anything that I am doing is always posted up on my website and different
Yeah,
workshops.
I've got it here, right? JennieAnstey.com. If you need some sessions with her, don't hesitate. Don't hesitate. Always good for you and your family. And it's a great, I think, a first place to go, don't you think? My gosh.
And I really do tell people, even if they have questions, my email is a 24-hour beeper. You know, I'm happy to answer questions on email. Sometimes parents just need resources and have little questions, and for that, I really am happy to answer whenever possible, or to get people directed to the right place to go.
Thank you for all you do.
You're very welcome. Thank you for all you guys do.
Thank you.
Jennie, you're closing us out?
Oh, like I said, I just want to come for an osteo session, but I've avoided it because I don't feel pain. You know, because I do so much yoga, I went to see an osteo because I got in a car accident and I still felt no pain and I almost died. But I also, however, learned that there are many, many reasons to go regularly see an osteo, even if you're not feeling pain. That might be the reason that we go in, but I do know there are a number of people who treat it as, you know, a very, very regular thing for their health, the way that some of us do with massage, etc. So just to say thank you, and I'm feeling very inspired and very happy that we do have you to send people to, and whether it's our clients who are pregnant or in postpartum, or whether it's for their babies, or all of the above. So yeah, thank you so much. So inspiring.
You're very welcome.
Thank you, everyone. We will catch you next week. We're live every Wednesday at 11:30, and I'm not sure what we're talking about next week, but we'll be there.
Perfect. Thank you.
Unless you know Jennie and want to beep in, but I can't remember.
Me neither.
All right. Have a great week, everybody. Thank you.
Bye-bye.
Take care.
Bye.